I am pleased to welcome you to another episode of McCready's Cast, where we explore the depths of health, wellness, current events, science, and philosophy. Today, my guest is Dr. Alexa Toronto. Alexa is a naturopathic doctor based out of Toronto who has a clinical focus in maternal care, that is preconception, pregnancy, and postpartum care as well. Her mission is to help women have healthy and empowered pregnancies and ultimately to thrive postpartum. Welcome, Alexa.
Thank you. I'm super excited to be here.
Okay, so let's get right into this. So I've spoken to a lot of about this with family, friends, colleagues, and even I was talking to another mindset coach about the birthing experience, pregnancy, etc. And she's actually a doula, and it can be quite traumatic, right? And so I think true, compassionate, empathetic maternal care is void or at best subpar in our current medical system. So I ask you, tell me a little bit about your journey. What inspired you, your experiences, because you are a mother, of essentially wanting to close this gap?
Yeah, so this is, like you said, my experience was exactly why I decided to narrow my focus to expecting moms or moms and moms to be essentially. So for me, what I found throughout the whole process from preconception to postpartum, there's so much transfer of care. You have to retell your story a million times. A lot falls through the gaps. Like I was shocked and again, I'm grateful for my background as a naturopathic doctor, but the amount of advocacy I had to do to run certain tests or clarify certain information really shocked me. For me, coming with a lens of extensive health background, I really remember going through every visit, sometimes even leaving visits in tears, to be honest, and thinking it's like, what would the average, mom or expecting mom come in here without my background and leave with if I'm coming in with this much background and still finding there was so many gaps. So for me, really seeing the amount of different healthcare providers I saw throughout the whole thing, none of them really knowing my story or understanding the whole process, I found it very disjointed. So once I started practice, I really decided to narrow my focus into that because I find the more constant touch point with one care provider who knows your background, who's going to ensure nothing falls through the gaps. And I think all of it is there's of course gaps, but especially postpartum, I really wanted to help capture that because especially postpartum moms often, it's hard to make it to visits. They don't know why they should be going to visits or who's really checking what. There's a lot of there's just so much information that falls through, so it's why I decided to narrow in on that because I experienced that firsthand both times in both my pregnancies. And same thing too, even that you touched on with like the traumatic birth thing. I find even with midwives and OBs, and I love working with them as well, there's so much information that moms should know before pregnancy, during pregnancy, how to prep for labor and delivery properly, and to prepare for postpartum. And unless they're seeking it out, no one's really telling them. So that's why I do what I do. Our visits are longer. We have the space in the room to go through all of the things to create the most empowering experience and process for moms and moms to be.
hmm Yeah, and we're definitely going to unpack that in this episode because I totally agree that women definitely, there's a lot that they don't know or they should know prenatally, pre-pregnancy, and even postnatally, right? As you mentioned, I can show them if you ask again. As you mentioned, conventionally, when women go through the whole experience, right, there's often transfer of care, there's a lot of confusion, there's a lot of frustration, right? And so this next question is kind of two parts. So what does working with prenatal patients look like for you?
Yeah, so working with prenatal patients. So for me, I love ideally, of course, patients to let me know as soon as they're pregnant because there's certain lab work that I do that isn't done in the standard of care. So when patient, but also too, like I had a patient book in last week. She's 37 weeks and we're going to start now. So it's more labor prep and now postpartum. But ideally, patients contact me earlier in pregnancy, ideally at 12 weeks or before. And then every patient's different. I like to have at least 2 or 3 touch points throughout pregnancy, 12 weeks, around 20 weeks, 28 weeks, in an ideal world. Sometimes more. I have some prenatal patients I see every week, some more, some less, but ideally at least a few touch points. We're making sure we're capturing the sensitive window. So for example, 12 weeks and before, it's like I'll make sure I'll run certain lab work that's just not done in conventional standard of care that does have an impact on pregnancy, like decreasing risks of preeclampsia, making sure iron levels are okay, preventing low mood, pregnancy and postpartum, like vitamin D, iron, and some other lab markers that aren't, they're unfortunately not screening guidelines. And when I explain to my patients why we're doing them, they're like, why doesn't everyone get this done? Or why isn't this? And again, eventually I hope it's some of the things I do. I hope they eventually become standard of care and screening guidelines because they're not little things to make you feel a little better. It's like they have long-term significant outcomes on both mom and baby. We can make a huge difference in this sensitive window. So, yeah, when I see pregnant patients, prenatal patients, at least 3 touch points ideally, so we can really kind of evaluate what's going on and also prepare them for the next stage of their motherhood journey before, because that's the big thing. Like even, postpartum care should start in pregnancy, and most people don't get that. So that's a big part of what we do throughout the pregnancy journey.
What would you say are perhaps 3 top tips for women during pregnancy?
Just in general.
Generally speaking, yeah. Whatever you,
Okay.
yeah.
There's so many. Okay,
I
so
know.
3, one of them would be, of course, to connect with a naturopathic doctor, again, to help fill in the gaps with that, because it really does make a huge difference, A, on actually how they feel, but also long-term outcomes. Connect with a naturopathic doctor who will, yeah, hear your story and work alongside you with that. Second would be, I know this is for labor and delivery, but it would be to hire a doula for labor and delivery. The research, even with that, with what it decreases emergency C-sections, use of interventions, doulas are such an amazing tool to help educate you specifically around labor and delivery. And if I wish every mom, whether it's a planned C-section or, a vaginal delivery, whatever it is, having a doula spend the time with you to go through the pros and cons, all the informed consent that really is glossed over in medical care with any other profession, just due to the time constraints. So, naturopathic doctor, it'd really be to gather your team. It would be a naturopathic doctor, hire a birth doula for labor and delivery. And a third tip would honestly be to prepare for the postpartum just as much as you're preparing for pregnancy and labor and delivery, because it's really the often under planned area that actually needs the most tending to.
Which brings me to my next question. You kind of transitioned there beautifully. What does working with postnatal patients work like? Even postpartum, that short window up until 1 year, 2 years, etc.
Yeah. So this is where there's a lot of confusion between medical providers, which is why I love when I can see my patients through the whole journey. Of course, some I just meet postpartum, but ideally, I like to have 3 visits within the first 12 weeks. And I know there's a lot going on. I'm also very transparent with my patients. If they need to change it or move it, I understand. I get how much of a whirlwind those first few months are. I like to see my patients in the 3 times in the first 3 months postpartum, because whether they're having milk supply issues or, struggling with low mood or whatever it is, I make sure all the lab work that should be investigated is done. Sometimes there's a confusion. Let's just say someone had thyroid issues during pregnancy. There's a little bit of confusion who's monitoring what, because, midwives have their patients for 6 weeks postpartum. Do they get transferred to their medical doctor? Who's running their iron? It's like there's actually, I find, even confusion between practitioners of who's running what. So the benefit of having an ND on your team is we are, high level overview, making sure nothing's being missed, whether it's us doing it or making sure your other medical provider does it. So for me, in the first 12 weeks, like to see my patients 3 times.
Mhm.
Beyond that, it really depends. Depends how pregnancy was, depends what the patient wants. Longer term follow-up is like, it's like whether it's even just every 6 months or every 12 years, it really depends, but what I do find, we really are the safety net. For example, I just had a patient who had postpartum thyroiditis, which is really hard to catch conventionally if you do one thyroid lab work, but we ran it several times and saw her levels going super high and super low. So we're able to monitor and see that and treat that effectively. And another good example that my patients are shocked is when patients had gestational diabetes during pregnancy. I always ask, like, oh, has your medical doctor talked to you about, screening for your blood sugar and diabetes once a year, because you're at a 5 times more likely risk of developing type 2 diabetes? They're like, nobody has ever told me that. That's what I'm really finding, is these things that happen during pregnancy that do impact long-term metabolic health, cardiovascular health. Nobody's telling them. So it's like there's a confusion of whose responsibility it is, and I just want patients to know whether they're doing the screening through me or not, it's my responsibility to inform them and make sure, and that's something I've been really shocked is how little guidance moms are getting to what potential screening, maybe it's a like, yearly, every couple of years, especially if there were events, um, in pregnancy. And then the other thing I see a lot is, of course, postpartum fatigue. Moms are super exhausted. There's a few things I'll test to make sure there's no underlying deficiencies. And more often than not, there's underlying deficiencies that we correct that no one checked, no one told them. They didn't think like and there's a normal level of fatigue postpartum, of course, especially in the early postpartum. But if it's lasting months and months and they're struggling to function, we need to do an investigation. And more often than not, I do find several things that we can address.
Mhm. I just want to backtrack a second because something stood out. When you mentioned thyroiditis, you said,
Mhm.
I guess, a lab marker that they test for, but there's, I guess, more in-depth testing. What are those biomarkers?
Yeah, so it's actually even with the TSH alone, we do check TSH, T3, and T4, but it's more that it changes so quickly and so suddenly. We really want to catch it in the first 4 months. So doing one TSH value for, yeah, I'll use my one patient for an example. I forget what it came back at, like 30 or 40, was super elevated. And then, then it went down to one or like point something. So it's like we had 4 or 5 TSH markers to see the trend to diagnose it correctly. Because if we would have just seen that TSH, that thyroid stimulating hormone, at one window, we might have given the incorrect diagnosis and incorrect treatment. So we were able to see multiple lab values over time, which is really important for thyroid because the thyroid can be a bit of a roller coaster postpartum. So it's really great to check in more than one time.
That's interesting because I mean I don't work with in the pregnant population, but a lot of the work that I do is from a functional medicine standpoint, which often involves doing like a deep dive in biomarkers. And I think the thyroid is a good example because conventionally we often, or I often see, again, is speaking from my personal experience, is just TSH. But TSH is just a very small subset of what's going on with the thyroid. We got to look for free T3, free T4, even look at anti-TPO, all these things. So it's amazing that you've kind of applied this domain of like functional medicine into pregnancy, because I think it's so important, and that's such a big gap that needs to be filled in the conventional medical model. So what are 3 tips, going back to this now, what are 3 tips that you would give to postpartum people?
Yeah. So again, I'm going to double up on one of them because I think it's so important is that postpartum, I'll say this once a day, every day for the rest of my life, postpartum preparation needs to start during pregnancy. It is not the time, 1 week postpartum to put together your care plan. We need to have a plan of who's helping, ordering your supplements in advance. If you're breastfeeding, like, or stocking up on your prenatal to take until you're done breastfeeding, which again, a lot of doctors don't tell their patients they should be doing. So to anyone that will be postpartum, hopefully you can hear this then, is plan for postpartum during pregnancy. It is so important. The other tips would be to, a lot of it is, I know it's easier said than done, but, creating your, whether it's your healthcare team or personal support team, our society is not set up to support postpartum women like it used to. A lot of us don't live in the village setting or have a lot of hands. A lot of people birth their babies. Maybe their partner takes a week off and then they're just on their own to continue their life as normal. It's not, I don't want to say it's not normal, but it's not sustainable. It's like, have some, one thing would be to have a healthcare team, whether, yeah, it's a naturopathic doctor, or if, in advance, set up your lactation consultants if you need someone, or therapists or whatever, or your just personal team. You need to have a network around you, whether it be hired and professional or, your family and support systems, and to ask for that help. Because I think the mentality I find in a lot of North America is just, birth your baby and continue as per normal, which is wild. Even people that get knee surgery, they get like a 12-week protocol from the hospital and all these things they should never do. But then like C-section, it's like, okay, like try not to lift your baby for a few days, then like good luck. It's crazy in my opinion. So I'd say because it's not built into our system, we need to create that ourselves, whether it's, like stocking up a bunch of food or having your at least 1 to 2 months postpartum kind of supported in whatever way. I know that was a bunch of little recommendations in the second one, but and then the last one was, which I know I kind of touched on there, is really food. Like postpartum is women, it's like it's not going to be the time to be making 3 meals a day, whether it's making a bunch of meals in advance and freezing it, having a meal delivery service, having a family member that's going to be your interim like sous chef or something, having food in whatever way ahead of time is so important. It's important to maintain for our energy levels, our mental health, especially, getting enough protein for actual tissue repair and recovery. That's something that most moms don't plan for. And it takes them a bit to be able to answer it, or they have to go back and questions when I say, okay, what's your food plan? Like immediately postpartum would really be to figure out, a month's worth of food ahead of time, whatever that might look like, because it's so important because I know I've been through it twice. It's so easy to go all day without eating or drinking and be like, "Oh my gosh, like I haven't had nothing today." You're so focused on your baby, but making sure we're nourishing ourselves so important because that has a direct impact on how we can, of course, parent. But I just find the food situation specifically, a lot of women aren't eating nearly enough, and then hard to maintain energy and milk supply if that's a goal and all those things. It would be to plan your food in advance, stock your fridge, stock your pantry because it's there's a lot less windows of time to be cooking immediately postpartum.
Mhm. I want to highlight actually one thing that kind of stood out for me that I think is quite relevant and that kind of resonated deeply when you mentioned, back in the day when women would give birth, they had their sense of tribe. Quite literally, when they would have a baby, they would be surrounded by a tribe, countless people around them to support them, which is vital to ensuring the health, of course, and the survival of the mother, the mental, emotional, and spiritual health. But when we fast forward to present day, it's exactly like you said, where mom gives birth, woman gives birth, and so off she goes, and their partner goes to work, presumably, and they're kind of left to kind of fend for their own, which is, as you mentioned, crazy.
Mhm.
Um, Talking a little bit about nutrition, what does nutrition look like for you when you're working with pregnant women?
With pregnant women, we really focus on the whole all the stages, honestly, from preconception, pregnancy, and postpartum. I really focus on what we should add in versus minimizing things. Of course, there's some things it's always better to have less processed foods, etc. But pregnancy, we like really want to make sure they're getting enough protein. That's always the biggest hurdle with all my patients and all the the three populations I work with is getting enough protein, sending them protein resources of how you should eyeball like how much, 25 or 30 grams is per meal, for example. We really focus on getting enough protein in all of them. But then pregnancy, for example, of course, we try to get in more fruits and vegetables and foods rich in choline, for example, because that's really important for baby's development. High iron foods, iron's really important for pregnancy. So depending on the stage, each stage is a bit different. But pregnancy itself will focus more on getting in, healthy fats, proteins, complex carbohydrates. We'll focus on what we should add in and also getting enough. And it's also tricky. I work, of course, with pregnant women that have a lot of aversions or nausea. And it's like we do what we can. It doesn't need to be perfect. That's not what we're going for. But we really just do focus on adding in, yeah, like protein, healthy fats, complex carbs, fruits and veggies, like really just getting enough. And ideally whole foods most of the time. But we also it's I meet patients where they're at and we work on their goals together.
Mhm. Um, I want to shift gears a little bit and talk a little bit about fertility,
Mhm.
right? So let's, in a hypothetical scenario, a patient walks through your door and they've been deemed, infertile by the conventional medical system, right? And this person wants to conceive naturally, right? So they want to exhaust all options first before seeking alternatives like in vitro fertilization, which I think is very expensive, maybe for like 15 to 20K. Medications like to play around with hormones, or IUI, like intrauterine insemination. So what does your approach look like for this patient? And then the second part to that is, what is the importance of having a discussion with their male partner around infertility?
Yes. So, yeah, both really big and good questions. So, more I'd say probably half my fertility patients, if not more, come to me with, like unexplained infertility. I really don't like that term because I'll of course, what it looks like working with me, I get them to send me all the labs they've done within the past 12 months or since they've been trying to conceive. I'll get their notes from their fertility clinic. I'll get all the things that they've done seeing me. It's usually quite extensive what they've done. With that said, So or I'll go through the process first. So I gather all the things they've done. I look through that. We do a really thorough intake, 75-minute intake where we go through their whole health history. They tell me their story, their journey so far to trying to conceive. And then I'll usually make a couple of recommendations. I'll fill in some gaps with lab work if need be, if certain things haven't been done. In my second visit is the customized care plan where we go through a short-term and long-term plan for their health. It covers nutrition, supplements, maybe acupuncture, and other things. So to go back to that though, what I really see a lot is it's unexplained infertility, but then I see their assessments and there's so much missing, whether it's autoimmune markers or vitamin D. Or I remember one that really stood out for me. There was a patient once who had 5 recurrent miscarriages all around like 7 to 10 weeks. And I was looking through all her lab work and they never even checked her any iron markers like ferritin, TIBC, all of these things that are really important to maintain pregnancy. If you're clinically iron deficient, it's going to be really hard to stay pregnant. Never tested. Was at a fertility clinic for years. So what I really do is I make sure no stone has been unturned, autoimmune markers, thyroid, vitamin D, iron, metabolic concerns like insulin resistance, etc. Like I really make sure it's all been done. And more often than not a lot has I shouldn't say not always, but I usually see some really crucial things that were missed or not assessed or not even gathered from the patient properly, whether it's their ovulation timing or how long their cycles are, how long certain parts of their cycle is. There's so much that I find we can do before, again, yeah, through dietary changes, supplementation. There's great research on, um, eliminating certain things, adding more things in. There's so much that we can do to support fertility. And for your second question, male partners absolutely need to be assessed. It's, they're 50% of the contributing factors. And that's another thing too, I find is sometimes I have patients come to me, the female patients saying, yeah, like my male partner was checked, their sperm analysis was fine. But then I look at it and yeah, it might be technically fine, but we naturopathic doctors typically have a narrower optimal range than what's deemed okay at some other clinics and at some other medical doctors. So I'll look at it and be like, well, it's technically fine, but they're on the extreme low end of normal of, whether it's the quantity or whatever it is. I find that's super important and often under stressed in fertility assessments.
Mhm. Yeah, I think that's so important because often when we think about infertility, generally speaking, again, a lot of the onus is placed on the female, right? And it obviously takes two people. And I think I want to talk a little bit about what you said in terms of optimal, because I think that's important to have that discussion where in labs, when we run labs, we typically have conventionally ranges. And in the conventional model, if you will, as long as you're anywhere in that range, you could be on the very low end, as you mentioned, on the high end, it's normal. In your opinion, what is the difference between normal and optimal?
So yeah, it depends on it's a really important discussion. It's something I educate all my patients on because a lot of them, have the typical, they come to me, they're like, all my labs are normal, but I don't feel well. I'm like, send me your labs. We look at the labs and it's not normal. Well, it's clinically normal, but
Mhm.
optimally not. So it depends. I'd say every lab is a bit different to have this discussion about, but often it can be a very different. Like I think ferritin's a good example. So I think in Ontario, I think the lower end right now is 12 and maybe upper end, whether it's 100 or 200 or whatever it is.
Mhm.
If people, show up with 13, it's not going to show up as abnormal. But for me, I want all my patients, preconception, pregnancy, postpartum, to have a ferritin of at least 40. If it's under 40, I'm immediately doing more investigations to see what's actually going on, like to check the more labs to see what their iron levels actually are. And more often than not, we end up needing to supplement. So, for me as a barometer of 40 versus 12, that's huge. That's a big difference. So I like that example because I see a lot of women and a lot of iron deficient women. So that's a pretty big range. And they'll come to me, 13, 14 for their ferritin, which is the marker of iron storage, and be like, my doctor said it's normal. So that's the big difference is where you need enough to just function and be a person and get up and move around versus feel truly well can be worlds apart sometimes on lab work.
Mhm. Yeah, and I'm similar to you. Like when I am doing lab work, which I have to do a lot of the times with my patients at base, just to get baseline, right? And then I have full in-depth discussions. I go over each biomarker, what it is, what it means, what it does for the body, and then I also always have that discussion between normal and optimal. And like you mentioned, time and time again, patients will say, "Oh, my doctor told me everything is normal," and then you look at it, and it's like, sure, it's normal as per these ranges, but these are far from optimal.
Mhm.
Going back to a little bit about fertility, because I think this is another important discussion, and we hear this time and time again. This window of fertility, I guess it's from 20 to 35, maybe more, maybe less. I'm not too sure. You probably can shed a little bit more insight into that, right? And we know after, let's say 35, and just as a hypothetical scenario where there's a higher risk of pregnancy-related complications, C-section delivery, perhaps chromosomal conditions like Down syndrome, risk of miscarriages and loss of pregnancy, right? I would love to hear your thoughts on this. Is it too simplistic to say anyone over 35 is high risk pregnancy, right? Because what happens if we have a person who's 35, 36, who has amazing biomarkers, their nutritional profile is stellar, ticks off all the boxes? What does that look like? So I would love to hear your thoughts on this.
Yeah, I think, of course, again, of course, there are certain statistics, the things that happen at 35, like all the things you mentioned. But like you said too, especially the way we practice with naturopathic medicine is we really take the whole person into account. I've had healthy, uh, really healthy pregnant patients, like, in their late 30s, even early 40s, where of course there's like a higher risk for certain things. But again, it also comes down to the individual, because I've also had patients in their mid to late 20s struggle with egg quantity and egg quality and low reserve. It's like I find, yes, there are statistics that go with that, but I would agree it's not black and white. It does depend on other things. And it's also like, I don't think it's as simple, in my opinion, as just like low risk, high risk. I think there's definitely a spectrum. And I think all the things with our health coming to the table, future history of pregnancies, like our previous health condition, and again, things we can check via lab work that can give us little whispers. Like I do now see on my lab work, even though it's not enough to diagnose, there's certain things that'll start to come up, like high neutrophils or high other things early in pregnancy, where it is an increased likelihood to have gestational diabetes or preeclampsia. It's like you can kind of even see earlier in pregnancy little whispers of things, especially when inflammatory markers are really high. So yeah, I wouldn't say it's black and white. I think it depends on a lot of health factors, just like of course the way that we practice. I really take a holistic approach with the patient's health, because I'd say age is one factor of many.
Mhm. Yeah, I would wholeheartedly agree in that. Of course, age and statistics are of relevance, but it is a nuanced discussion, and I think that's amazing in terms of the work that you do, where you look at the patient holistically, whether that's through biomarkers, nutrition, stress, environment, because all these things play a critical role into becoming pregnant, of course.
Mhm.
Um, you started, or perhaps in the process of starting, an initiative. This initiative, from my understanding, is a free private community for moms and moms to be.
Mhm.
Can you tell me a little bit about this?
Yes. So this is brand new. It's funny you mentioned that. I'm just planning to do talking about prenatal lab work in it next week.
Okay.
So since I've been pregnant with my first daughter, which my first daughter is 4 now, I've just always envisioned having a space for moms to come for information. Of course, not direct medical advice, but like these things I'm talking about, understanding reference ranges with lab work, understanding what they should be asking for, advocating for, maybe, like sharing their stories, asking these things. I really want to create a free space where everybody can access, because I understand too, not everybody can or even maybe wants to work one-on-one with an ND, like for whatever reason. And I just want to, yeah, I want to create a space where moms can ask questions, get information. And I really do believe like the information I want to share there is something I wholeheartedly believe all moms deserve to know, because it changes outcomes. Like it can change prenatal outcomes, postpartum outcomes. I really am excited to start sharing more information in there. I'm going to start just going live in there once a week. I think next week I'm going to go over, prenatal lab work that's done outside of conventional care to help with prenatal and postpartum outcomes, like depression, gestational diabetes, like low iron, and why we even care. It's not just know your numbers, know your numbers. It makes a long-term difference. So yeah, I'm really excited. I just opened it a couple weeks ago, and it's welcome for all moms and moms to be that just want the information that will help them make more informed and empowered decisions for their health.
Yeah, I think that's amazing, because I think it just boils down to the awareness, right? A lot of people just simply do not know. And so doing things like you're doing with these initiatives is raising awareness, fostering that community where people can come together and have these discussions and have answers to their questions. So that's amazing. As a mother, what have been your most difficult challenges raising children, despite, of course, the beautiful rewards, I'm sure?
Challenge? I think we're still in it. I'm sorry for any parents newly postpartum that hopes to send it's the sleep is hard. Of course, there's fragmented sleep early postpartum, and that almost I find easier because there's so many like, there's so much adrenaline and hormones to kinda keep you through it. It's a very fragmented sleep at the beginning for a lot of moms. Um, See, I have 2 daughters now, so as soon as my one daughter started kinda sleeping through the night, now my other daughter, my older one, started waking up again, and now she just moved into our room. Like, it's for me, like, truly the hardest thing is operating on broken sleep, honestly, more often than not. I didn't think 4 years in this would still be my main problem, but it is, and I combat it in different ways, like, I make sure I eat really high protein breakfast, like, I really lean on my other foundations of health more, like, my nutrition's dialed in, I move every day no matter how tired I am, like, there's other things I need to do because I know my sleep is broken, and there's not a ton you can do about it in certain situations. Right now, my daughter's scared of monsters and different things, and she sleeps in our room and, kicks me or like whatever it is. It's like it's really fragmented sleep now with my older one again. So for me, it's been there's little windows where we're sleeping. Sleep is hard. It's not easy.
How old are they? How old are your daughters?
1 and 4.
How have they been similar and or different in terms of like the birthing experience after you've had them, in terms of colicky? Has there been any similarities and or difference in terms of like personality, what they're scared of, that type of thing?
So personality so far, yes, as much as you can tell, like with a 1-year-old. Like I think it's also a birth order thing. My second seems way more independent, like, because she's never really had totally undivided attention when my other daughter's at home. So I do already find my younger one, we're doing bedtime. She just crawls to her own room, like opens up books, just like sits there, plays alone so much already at this age, which my older one didn't. But I think it's because my older one, birth order, she had the undivided attention all the time. They also don't look related, which is interesting. They don't look anything alike. But birthing experience wise, I had 2 very different experiences. Like my second, without this would be like a whole other show, but with my second, I actually had her at home, and that was very different. I had my first in a hospital. I learned a lot about labor and delivery after my first, so that equipped me for my second one better. And then postpartum, and again, I really do um, think my background also just like my resource gathering with postpartum, again, I know everyone's different.
Mhm.
I honestly felt better postpartum than I did pregnant. I was really sick in my pregnancies. I had every virus. Once for my second pregnancy, once I had a toddler too, she was home from daycare sick every week. Like it was for me, I like threw up every day until 25 weeks. Like I did not have an easy pregnancy, either of them. So for me, I actually felt better postpartum, but also too, I had someone making all my food. I had the team. I had like my mom came and moved in with us. My husband was on it too with food. It's like I did have a lot of support postpartum, which I know not everybody does. So I felt better physically, actually, not like of course the day postpartum, but like within the first month for me, I felt better postpartum than I did pregnancy only because I was sick a lot in my pregnancies.
You mentioned your first birth was at the hospital, I guess in the conventional ward, and the second one was at home.
My first one, and actually, this is the only one in Canada. It's actually was in a midwife unit in a hospital. It's called the Alongside Midwifery Unit in Markham. So I was with midwives of both my pregnancies, but I think some of it also just comes with, experience. Like I there was, and that's also why I love helping prep women for labor and delivery during some of our prenatal visits. I even actually do, as an aside, I'd even do like one-on-one like labor and delivery prep classes with people, like run as a naturopathic doctor. We go through all the physiology, what to expect, how to prepare, because I think most women are very underprepared for labor and delivery, especially mentally. Like we go through a lot of how you prep yourself to be, in moments of big like discomfort and tension, and how to relax and breathe into those. That's not something that requires practice. Like, and there are ways to practice it. There's a lot of tools and techniques and things that I offer to patients to get in that zone because it's like a marathon. You would never not run and then go run a marathon. Like labor and delivery is the marathon you want to train for. And there's so much that we can do mentally, emotionally, and physically to ensure the best outcomes, because it's a really transformational experience for some people. It's extremely traumatic and takes a lot of time to heal from. And again, we can't plan all of it. Birth is still wild. We can prepare, but then whatever happens, happens. My second one, I know this is a big statement, but I truly, like, to my soul believe it. It completely changed the trajectory of my life. It was the most empowering experience. I was pretty undisturbed. I felt really, again, I also had them, I felt more ready because I've done it once before. I do think the experience helps,
Mhm.
but I prepared a bit differently this time. And it, like, I remembered, like, I don't know, an hour and a half after delivery, like sitting in my bed, like looking at my partner too, and just being like, like that was effing awesome. Like, if I can do that, I can do anything. And it was like, I've never experienced such a high like that. And after that, I'm like, wow, I would love to help more women get to this state, because it truly has changed what I think is possible mentally, emotionally, physically in my life. It's like, if I can do that the way that I wanted to do it, like I can, like, anything else is like figure outable, piece of cake, And it's like, I think women are so, again, this will be controversial, but I think women are really lucky to be able to go through this huge portal of transformation. And it's an opportunity for huge transformation. Again, there's an array of outcomes that can happen, but I have patients that have planned C-sections. Like, when they feel empowered about their decisions, it can still be the most empowering experience of their life. It's not like what happens makes it empowering or not. It's like a big part of it is how they were treated, how they felt, if they felt informed, because it's not so much what interventions did or didn't happen. If you were at home, hospital, birthing unit, whatever, it's truly like how you felt about the experience and how you were treated and how empowered and like how informed you felt really is, like, research wise, it shows regarding birth trauma, a lot of it is the way that the women were treated. It's not what interventions did or didn't happen, which I think is a really important point.
Mhm. At your home birth, what type of healthcare professionals were present? And the reason why I asked this question, I just want to preface this because I think it's important, is, you and I kind of you are way more familiar with the whole situation than I am, of course, evidently. But perhaps that women are just, listening and thinking, "Oh, you gave birth at home," like that. See, that could be seen as such a foreign experience. It's like, you mean you weren't in a hospital with doctors, and if something went wrong, another doctor could come in, like a team. So I just want to maybe talk a little bit about that, because as you mentioned, I think it could be such a beautiful and empowering experience, as long as you're aware of it, you're familiar, and know about it. So perhaps you can shed some light.
Sure. I would agree. Most people are shocked. We actually stopped telling people because we started telling people that was our plan. People are like, they see the color drop from their face, or people did. Birth is a very triggering topic for people, and um, I get it. When people are deciding what to do, I think the answer is always it depends. So for me, why I chose to do it at home, I was really healthy. My first delivery was smooth. I'm 5 minutes away from a hospital. So it's like these things come into account. If I was an hour away from a hospital, what wouldn't be open to it? I'm 5 minutes away from a hospital. Um, I was low risk, had a healthy pregnancy, like no complications last time either. So there was a bunch of things that came into making the decision if we wanted to do this at home. For me, yeah. So at the home delivery, I had two midwives, which will always be there, like in Ontario, two midwives. And I had a naturopathic doctor slash birth doula. She's both. She's an ND and a doula. So I had her, and then my partner. So there was four people, but like healthcare professionals was the two midwives.
Okay. And
Mhm.
so, if somebody asks you, so there wasn't a medical doctor present, how come?
So, how it works with home births or even just midwife deliveries in general. So, even if you have a midwife in the hospital or a birthing center, whatever it is, unless it turns into a high risk delivery, so whether you need interventions or a C-section or whatever it is, they are the primary care provider. Like they're the primary healthcare provider unless intervention is necessary. And also, too, the other thing that I didn't know, which helped me make my decision to do it at home. Because the way when people are asking what to do, again, I know it's not very common to do here. I also like to remind people it is a physiological process. Yes, of course, things can go wrong. And that's why for me, if I was further than 10 minutes from a hospital, I probably wouldn't feel comfortable. Like, everyone has a different level of risk adverse they want to be. For me, because of all of the factors we put together, and because they transfer you on something called pink flags. So we know like red flag symptoms that are something serious or something to look out for. So midwives work on kind of pink flags, meaning I'll just give a birth example. So when if your water breaks first and you have the water is like tinged brown or there's any meconium in the water, which is like baby's first bowel movement in a hospital, if that happens, it doesn't turn into an emergency. They will have like a respiratory professional on call to if they need to do any aspiration or do any interventions. If the risk is baby like inhaling it essentially or swallowing it. But if you're planning a home birth and your water breaks and there's any tinge of color like in it, and they're meaning the meconium, right to the hospital. It's like they won't, or like, if baby's heart rate drops, we're transferring the hospital or whatever happens. Like they really, 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 really err on the side of caution for obvious reasons. And that's the thing too, like things that wouldn't really even be a concern at a hospital, they will just transfer out of like extra caution, which is amazing. They also do home inspections. Like they came and checked my home to make sure, that if we needed an ambulance, that they can get up my stairs or that the setup, like they come do home visits. They check your area, what works, how to set up the place, all the supplies. They bring the supplies. They drop off all their medical supplies first. Like they set up a table with all of their equipment like beforehand. So I felt really secure doing so. Again, it's such a personal decision. I know some people hearing this will immediately like maybe think, okay, maybe don't want to work with her if because some people think home births are inherently dangerous, which I think, again, I don't think anything's black and white. I think there's also, again, I'm not like pro one or another. I always tell moms like wherever you feel the most comfortable and that you think you can relax is the most important, because when we relax and feel safe and secure, that's when we produce more oxytocin. It brings on more contractions. And for some people, they feel the safest at a hospital, which then definitely go to the hospital. For me, without going into the whole thing, I had some negative experiences in the hospital with my first. I was very forced and pressured into doing things that was very cold and clinical during my first one before my midwives arrived. And there was a lot of pressure just to speed things along for their schedule. Like I felt very rushed during my first pregnancy, even though I was having contractions. They were like, no, we should do this. We should do that. Let's speed this along. Like it was very like hurry it up. And then also too, like that can lead into unnecessary interventions, and no interventions are without risk. Like even the hospital getting induced, having, vacuum, forceps, C-section, etc. It's like, there's not zero risk in a hospital either. And mistakes can happen there. And they're actually, there was some like medical mistakes during my pregnancy, like interventions and lack of communication between medical professionals. So for me, I actually, again, even though technically it was like smooth, like no complications, the emotional part, even though someone that would have watched, I would be like, oh, that was a smooth delivery. I actually like, went to therapy after, worked through it with my midwives, like kind of closed the loop on the experience, because, to have a traumatic birth experience, like they can happen however they go, right? It's really how you were treated is a big part. And, debriefing, talking to someone, kind of, closing the loop on that experience, I don't think is culturally done here. And especially when it's traumatic, and working with a therapist, or if it's a midwife or whatever or like MDs and OBs won't sit with you for an hour to like debrief. So that's why midwives will sit a bit longer, 45 minutes to talk about it. But even whether it's a therapist, there's some therapists that specialize just in birth trauma. And like kind of closing the loop on that experience is really important. So the reason I wanted to share that, for me, I wasn't all negative at my first one, but there was a lot that happened that even my midwives were like, that wasn't supposed to happen. Like there was a lot that happened that took me months to really process. And so that's why the next one I was like, okay, for me to remove some of those obstacles would just be to be at home. Like no one can rush me at home or anything like that. So my decision was the environment. And I felt, I did a lot of birth prep mentally, emotionally, and physically. I felt really confident and comfortable in my ability to birth my baby at home. Again, of course, with midwives, I would never personally do like a free birth or not having any professionals there. 2 midwives, the birth doula, and my partner, I felt like it was an amazing team, and it was awesome. Like not like I want to do it again tomorrow, but like it was incredible. Like start to finish was amazing. I loved it.
Yeah, and you mentioned that some people might think it's inherently dangerous, but I just want to parse that idea, because of course, I think pregnancy has been highly institutionalized, right? And at the end of the day, whether you want to have a birth at a hospital with medical doctors and go through that process versus, midwife at home with doulas, etc. I think, as you mentioned, the support will be there working with you, right? And at the end of the day, I think that's important. I do want to ask one question because some people might not be aware of what is the difference between a midwife and a doula, because we've used these terms, but perhaps some people might not know what they mean.
Yeah, a lot of people use them interchangeably, so I always like to make the distinction very different. So midwives are your primary care provider while you're pregnant. They have, 4 years of education. They are trained as midwives to do uncomplicated, low risk labor and delivery. So they do all of your checkups. They are there for your labor and delivery, and then they follow you up till 2 months postpartum. So they are your like first like medical professional primary care provider for you and baby. Doulas, on the other hand, are really there to advocate and support mom. That essentially is they're there to help you, make informed decisions. Usually, typically for doulas, you'll meet with them twice during pregnancy to go through birth preferences, get to know you, all of that kind of stuff. They attend your labor and delivery as a support person. So often they'll also do a lot of hands-on measures like pain relief. They'll like do like things called like double hip squeezes and counter pressure. And if they're a naturopathic doctor, also they can do acupuncture. Like they help prep you for labor and delivery, also mentally, emotionally, and physically. So the doulas are mainly there to help prep you. You have several hours with them before to go through all your preferences. They really go through, okay, if so and so happens, do you want this or that? Here are the pros and cons. They're so good at helping people make informed decisions, but they're essentially there to advocate for mom. They're not a medical professional. They're not there. I mean, they can help with baby, but they are there like for the mom to help support them. And again, some people just want verbal coaching with pushing or like whatever it is, but they're there to help make sure mom's preferences are pretty much listened and heard to, because it's definitely not the time like in labor and delivery to think about all these things for the first time. So they're really there to help advocate for mom, educate mom beforehand, to just help her have the birth that she's envisioning, essentially.
Mhm. Amazing. I just want to kind of round with the discussion and ask a couple of last questions. What is something that you wish you knew prenatally and postnatally? And if you will, remove your hat as a naturopathic doctor, because of course you have, extensive education and you're very knowledgeable around pregnancy, postpartum, and prenatal. So let's hypothetically say that that's not you anymore. You're just a person who has no idea about anything. What is
Mhm.
something that you wish you knew going through this experience?
It's a good question. I know it's hard to remove one of my many hats that I wear. Prenatally, I guess I really didn't know like how anxiety provoking it would be and how normal it is. I really had no idea. I've never really struggled with anxiety before, and like my first pregnancy was so anxious. Like I didn't realize there's always like the next thing. Like, okay, you do the test, then you wait for the blood test to get the confirmation, then you do the 12-week scan. It's like a lot of it. I didn't realize how mentally challenging it would be and how much like I so recommend working with a therapist. It's also I want to just normalize it. It's so of course normal to be anxious, but for me, I didn't realize how high my level of anxiety would be. Like I remember even thinking, okay, once I make it to the next visit, I know everything's fine, then I'll feel okay. Then this, then that, but that's just the whole pregnancy and then all of child. Like and then when they're children, that just doesn't end. So I think that really took me by surprise, like how much uncertainty and anxiety there is. So like the other side of the coin, it would really just be like whether it's working with a therapist or, practicing more mindfulness or whatever it is, the pregnancy game or pregnancy experience is um, such a mental experience. And yeah, the anxiety for me was, I didn't expect that. So then no one really talked about it. Once I started to actually, like, I'm an open book. I'll tell other moms like, oh yeah, I was anxious 10 out of 10 my whole pregnancy. Like no one told me. It's like
Mhm.
people are sometimes not super open and honest about what pregnancy and postpartum are actually like. So I think just the anxiety, I had no idea it can be such an anxiety provoking experience.
Mhm. And then postnatally?
So what the question was, what I wish I knew?
Yeah.
What I wish I knew, hmm, was honestly, again, this is kind of on the same train. I just didn't realize how you'd kind of just feel like every day is Groundhog Day. You're kind of just in this blur where you don't know what day or time it is. Like I didn't realize how long that phase would be. And again, it really came down to I was also like the first of my friends to have kids. Like I didn't know that many moms at the time. I mean, I know a lot of moms now, and now it's more like open and honest discussion, but I just didn't know how, again, honestly, just challenging mentally it would be with like the fragmented sleep. But I think, yeah, I wish I knew how, um, yeah, honestly, like I think the emotional component is often underspoken about, and that was challenging. And honestly, for my first, I didn't know. And again, as soon as I had my first delivery, I dove deep into the birth research, birth supporting child education world. I didn't realize, if everything goes smoothly, you could still really struggle mentally, like, with like having a quote unquote like traumatic birth. So I also didn't no one ever mentioned that to me, that they were like, yeah, even if everything goes like okay, you can still really struggle mentally after. So I think knowing like that that's normal, that like reach out to healthcare providers, like talk about it honestly. I think it helps a lot than just like trying to deal with it internally on your own.
Yeah, I think that's such an important point that you mentioned. Whereas, of course, physiologically, there are many changes that are happening within, but mentally, it's probably just as much, right? So it's important to like normalize it and talk about your feelings, emotions, and what you're going through both during pregnancy and after, because a lot of these things are overlooked, right? Where you have the baby and then that's it. Now it's time to raise it.
Mhm.
Uh, One last question. What would you say are your top three supplements now to use with a person who is pregnant for just general health and well-being? Now, let's assume we're not doing like iron, vitamin D, like forget that. Let's just say those are fine. Just general supplements. And I do want to just give a little bit of disclaimer. Anything that we discuss here is just for the purpose of discussion. And if there is a need for a supplement or you want to take something, it's always important to talk to your doctor.
Yeah. So again, I always have to give my spiel too that like it's so individual. But the one thing that I do find, and I do switch a lot of patients, is a high quality prenatal. Not all prenatals are created equally, from like preconception to postpartum. Some are missing some like pretty major things in them. When you look at the what's on the market, there's really only three even like brands, or there are two that I like really, really like. But making sure you have a high quality prenatal is really important. That doesn't have a bunch of unnecessary stuff in it if we don't need. Um, Again, high quality prenatal. Yeah, if we're excluding iron and vitamin D, which a lot of people need to be on. Because one thing I do want to say with that is when people are iron deficient, the amount of iron in a prenatal is not enough. Like a lot of people come to me and say, "Oh, I know my iron's low, but there's 33 milligrams of iron in my prenatal." It's like not even close to enough. So that's something people just make that mistake a lot. Other general ones, I know it's really hard generally in pregnancy because it depends. If people are like nauseous, I do high dose ginger, like ginger extracts, not just ginger candies. If they're struggling with a lot of cramping, we do magnesium, or constipation, we'll do magnesium. Like it depends. Another one too that some people don't think to take sometimes is even vitamin C or immune system is suppressed during pregnancy. So like supporting our immune system, even like higher dose vitamin C, etc. I know those are a few different things, but I'll leave it at that because like the honestly the high quality prenatal is something I don't see a lot of patients on, and it's really important.
What are some minerals, nutrients that are in prenatal?
So there's a lot. There's quite a long list. There's B vitamins, choline. That's like choline's so important for pregnancy. It's not in all prenatals, so that's why I like to check that. And sometimes too, like the folic acid should be in all prenatals, like the 400 micrograms. That's pretty standard. But what I find too is sometimes they'll even have something, but it's in like the smallest amount possible where it's not doing anything. Like it's just there to be on the label. It's like not in the therapeutic range. So that's something too that I'll discuss with patients is it's quite an assortment. It's essentially like a multivitamin with folic acid for the most part, but they're not all of them have everything, and some of them the amounts are completely insufficient. They may as well like not be taking it kind of thing. It's like I really like to be more targeted with what we're taking.
Yeah, and we see that I think a lot in just general multivitamins, where a patient will say, "I'm on a multi," and it has a lot of good things in it, but as you mentioned, the therapeutic dose is almost void, if not absent.
Mhm.
Um, any last closing remarks before we close this discussion for today? Any sort of last thoughts?
Yes, actually, just because of the one thing we spoke about, like with, struggling with mood or mental, emotional stuff, I'd like to tell patients that they're always surprised about. So, which I was surprised to learn too, a couple of years ago, that right now, the Canadian guidelines, again, for anyone listening to this in Canada, the Canadian guidelines actually, it's like the Canadian Task Force, I forget the name of it right now, but for postpartum, right now, there is no universal screening guidelines to screen for mood or postpartum depression. So, what I like to tell patients, and I tell them, while they're pregnant, of course, going into postpartum, when they go to their 6 week checkup, I'm like, if your doctor or midwife or whatever doesn't ask about your mood, it's not because they don't care or whatever it is. It's that unless they were diagnosed with a mental health condition prior to pregnancy or during pregnancy, they will not be asked, which I think is just really important for people to know. Again, that's why I work with people to fill in the gaps, but also, we have to dive deeper than to be like, how are you feeling? Most people are like, good, fine. Like, let's see if baby's okay. It's like so many women struggle with postpartum blues and postpartum depression. I just like people to know that unfortunately right now in Canada, it's just not a part of the screening guidelines. And the reason for that is like they don't really have anywhere to refer patients to. There's not a system set up right now. And I just know the reason I just want that to be one of the take homes is a lot of women struggle with mood postpartum. And at least in Canada, there's not a great way to capture that properly and follow up with those people, because it is, again, normal for there to be some level of emotional changes, but like to be really struggling and not being able to get through the day, or if it's happening weeks or months out, we need to support those moms.
Excellent. That is, I think, a perfect way to end off and round up the discussion. Alexa, thank you so much for coming on the show today. You've shed some valuable insight, and I'm sure many people who tune in will have a lot of take home messages from today's episode.
Awesome. Thank you for having me.